is to produce measurable blood pressure effects. Biata organic beet juice, available at Whole Foods and natural grocers at approximately $7 for a 500 milliliter bottle, is a less concentrated but widely available alternative, providing approximately 300 milligrams of nitrate per cup. Now, here is the specific warning that anyone over 60 on cardiovascular medication must understand before adding beetroot to their routine. Beetroot lowers blood pressure. If you are already on amlodipine, lisinopril, metoprolol, or any combination of antihypertensives, adding a concentrated beetroot product introduces an additional vasodilatory signal to a system already under pharmacological management. The risk is additive hypotension, meaning blood pressure dropping further than either intervention would produce alone, with the orthostatic drop risk most dangerous in the morning hours when cardiovascular pressure reserves are already at their lowest point of the day. The correct approach is to introduce beetroot juice in the smallest available serving size, measure blood pressure before and 2 hours after the first dose, and report any dizziness, lightheadedness, or unusual fatigue to your physician. This is not a reason to avoid it. It is a reason to introduce it with the same care you would give any new cardiovascular intervention. One additional practical note: beetroot juice turns urine and sometimes stool pink or red. This is called beeturia. It is harmless, and it alarms patients significantly if they are not warned about it in advance. It is not blood. It is simply the betalain pigment from the beet passing through the urinary system. Knowing this in advance removes what is otherwise a very stressful morning discovery. Victor was 71, a man who had read online that dark chocolate lowered blood pressure and had taken this information and applied it with characteristic enthusiasm. He was eating 2 to 3 full-size bars of Lindt 70% dark chocolate daily, available at Walmart and most grocery stores for approximately $3 per bar. His blood pressure had improved modestly. His weight had increased by 11 pounds in 3 months. His cardiologist, reviewing his labs, found elevated LDL cholesterol and noted the weight gain with concern. The food was not wrong, the dose was. The cardiovascular benefits of dark chocolate are among the most robustly documented in the food science literature. The active compounds are flavonols, specifically epicatechin and catechin, which are found in cacao in concentrations that are directly related to the percentage of cacao solids in the chocolate and inversely related to the degree of processing the cacao has undergone. These flavonols stimulate nitric oxide production through a different pathway than beetroot's dietary nitrate route, specifically by activating endothelial nitric oxide synthase, the enzyme in the blood vessel lining that produces nitric oxide on demand. The result is the same: vasodilation, reduced peripheral resistance, lower blood pressure. A meta-analysis published in the British Medical Journal examining 14 randomized trials found that cocoa consumption produced a mean systolic blood pressure reduction of 2.77 millimeters of mercury and diastolic reduction of 2.20 millimeters of mercury compared to control. A larger Cochrane review of 35 trials found consistent, statistically significant reductions in both systolic and diastolic pressure across hypertensive and pre-hypertensive populations. In hypertensive patients specifically, the effect size was larger, with some trials showing systolic reductions of 4 to 5 millimeters of mercury at consistent daily doses. The dose that the clinical trials use is specific and important. The majority of studies showing measurable blood pressure effect used between 6 and 30 grams of dark chocolate daily, with a cacao content of at least 70%. 6 grams is approximately 1 to 2 small squares from a standard bar. The trials showing the strongest results used 30 grams, which is approximately 1/4 of a standard 100-gram bar. This is a therapeutic dose range, not a license for unrestricted consumption. The products that perform best are those with the highest flavonol retention, which means the least processed cacao. Lindt Excellence 85%. Dark chocolate, available at Walmart, Target, and most grocery stores at approximately $3 per 100-gram bar, is one of the most consistently available high-percentage options with reasonable flavanol content. Green and Black's organic 85% dark chocolate, available at Whole Foods and on Amazon at approximately $4 per bar, uses organic cacao and minimal processing. Hue Chocolate, simple dark chocolate 70%, available at Whole Foods and Target at approximately $5 to $6 per bar, is produced without refined sugar and with minimal additives, which is relevant for diabetic patients monitoring glycemic impact alongside blood pressure. The critical practical guidance for patients over 60 is threefold. First, the dose matters in both directions. Below 6 grams daily, the flavanol quantity is insufficient to produce reliable cardiovascular effect. Above 30 grams daily, the caloric load, the saturated fat content, and in diabetic patients, the glycemic impact, offset the cardiovascular benefit. The therapeutic window is narrow and should be treated as such. Second, milk chocolate provides no meaningful flavanol benefit. The dairy proteins in milk chocolate bind the flavanols and reduce their bioavailability substantially. The percentage must be at least 70%, and the product must be genuinely dark chocolate, not a milk chocolate bar with a dark chocolate label. Third, patients on warfarin sold as Coumadin by Bristol Myers Squibb should discuss dark chocolate consumption with their physician because high flavanol intake can have mild antiplatelet effects that may alter bleeding time in anticoagulated patients. Eleanor was 64, a woman who had developed high blood pressure after retirement and was managing it without medication through dietary changes she had researched carefully. She had read about hibiscus tea, purchased a bag of Celestial Seasonings Red Zinger herbal tea from her local Target, and had been drinking 2 to 3 cups daily for 6 weeks. Her blood pressure had improved. Then her rheumatologist, who she was seeing for early-stage arthritis, prescribed hydroxychloroquine, and within 10 days of beginning the new medication, Eleanor was experiencing episodes of significant dizziness and near fainting. A medication review identified the interaction. Hibiscus has documented antihypertensive properties. Eleanor's blood pressure, now being managed by both the hibiscus and the new medication's effects on her cardiovascular system, had dropped too low. Hibiscus sabdurifa is the botanical name for the plant whose dried calyces are used to make hibiscus tea. Among all dietary interventions studied for blood pressure management, hibiscus has arguably the strongest clinical evidence base. A randomized controlled trial published in the Journal of Nutrition in 2010 compared 3 daily cups of hibiscus tea to a placebo beverage in 65 pre-hypertensive and mildly hypertensive adults and found a systolic reduction of 7.2 millimeters of mercury in the hibiscus group compared to 1.3 millimeters in the placebo group. A meta-analysis published in the Journal of Hypertension in 2015, reviewing 5 randomized controlled trials, found a pooled systolic reduction of 7.58 millimeters of mercury and diastolic reduction of 3.53 millimeters of mercury in participants consuming hibiscus tea. To put those numbers in direct comparison with amlodipine, the average systolic reduction produced by amlodipine 5 milligrams over a 4-week period in newly treated patients is approximately 8 to 10 millimeters of mercury. The hibiscus effect in the studies producing the strongest results falls within the lower end of that range. And critically, the onset of the hibiscus effect in the clinical trials was documented within 2 to 6 weeks of consistent daily consumption, which is comparable to the stabilization window for a new amlodipine prescription and faster than the drug's plateau in patients being titrated upward. The mechanism of hibiscus is multifactorial. The plant contains anthocyanins and other polyphenols that inhibit ACE, the same enzyme that lisinopril targets, producing vasodilation through hormonal pathway blockade. Hibiscus also has mild diuretic properties, reducing circulating fluid volume, and its antioxidant compounds reduce oxidative stress in the endothelium, the inner lining of blood vessels, improving vessel flexibility and responsiveness. 3 complementary mechanisms, all operating simultaneously, explain why the blood pressure effect is larger than most single mechanism dietary interventions produce. The product and preparation specifics matter significantly. Not all hibiscus teas are created equal in terms of hibiscus concentration. The studies showing the strongest results used standardized hibiscus extract or teas brewed from whole dried hibiscus calices at a concentration of approximately 10 grams of dried hibiscus per 500 milliliters of water, steeped for at least 10 minutes. Commercial tea bags contain varying amounts of hibiscus and often blend it with other ingredients that dilute the therapeutic dose. The most reliable commercially available options are as follows. Frontier Co-op Organic Hibiscus Flowers, available on Amazon and at Whole Foods at approximately $8 to $10 for 16 ounces of dried flowers, allows the patient to brew at a controlled concentration using 1 to 2 teaspoons per cup. Traditional medicinals. Hibiscus. Herbal tea bags, available at Whole Foods, Target, and most grocery stores at approximately $6 for 16 bags, uses whole hibiscus flowers per bag and has been tested for consistent polyphenol content. Celestial seasonings. Zinger teas contain hibiscus, but as part of a blend that reduces the concentration below the clinical study thresholds. For therapeutic rather than supplementary effect, single-ingredient hibiscus products are significantly preferable. The protocol used in the highest evidence clinical trials is 3 cups daily, each brewed from approximately 1 teaspoon of dried hibiscus flowers or 1 high-concentration tea bag, steeped for 10 minutes in hot but not boiling water. The tea can be consumed hot or cold and may be lightly sweetened with a small amount of honey. Patients managing blood sugar should note that adding table sugar or high sugar sweeteners offsets some of the cardiovascular benefit through glycemic effects on endothelial function. Now, the interaction that is absolutely critical for every patient currently on any antihypertensive medication, and especially for patients on diuretics, ACE inhibitors, or ARBs. Hibiscus tea lowers blood pressure through ACE inhibition and diuresis. If you are already taking a medication that inhibits ACE, lisinopril, ramipril, or enalapril, adding hibiscus introduces a second ACE inhibitor into your system. If you are already on a diuretic like hydrochlorothiazide or furosemide, adding hibiscus introduces additional fluid loss on top of pharmacological fluid loss. In both cases, the combined effect on blood pressure can exceed what either intervention was designed to produce, and the result in older adults can be a sudden, serious blood pressure drop. The correct introduction protocol for any patient currently on blood pressure medication is to start with 1 cup daily in the afternoon, measure blood pressure before and 90 minutes after the first cup, and report any dizziness, unusual fatigue, or lightheadedness. Increase to 2 cups in the second week and 3 cups in the third, measuring regularly throughout. This is not overcaution. This is applying to a dietary intervention the same graduated titration logic that physicians apply to every new antihypertensive prescription. There is one additional interaction that requires specific mention. Hibiscus tea has been shown to reduce the absorption of hydroxyurea, a medication used in sickle cell disease and some cancers, and may interact with acetaminophen metabolism at high consumption levels. Patients on either of these medications should consult their physician before regular hibiscus tea consumption. The most common mistake patients make after learning about these 3 foods is adding all 3 simultaneously on day 1 at full dose while continuing their existing medications and not measuring their blood pressure daily. This is the clinical equivalent of adding 2 new antihypertensive medications to a regimen at the same time and not monitoring the result. Margaret was 73, motivated and health conscious, who watched a video similar to this one, went to Whole Foods the next day, bought Beat It Sport shots, Who Dark chocolate, and Frontier dried hibiscus flowers, and began using all 3 at the doses described in the research literature. On the 5th morning, she stood up from bed and found the floor before she expected it. Her husband called an ambulance. Her blood pressure in the emergency room was 82/54. Her regular medications had not changed. What had changed was that she had introduced three independent vasodilatory and diuretic mechanisms simultaneously onto a pharmacological baseline that was already controlling her blood pressure. The correct approach is sequential introduction over 3 to 4 weeks. In week 1, introduce hibiscus tea at 1 cup per day and measure blood pressure morning and evening. In week 2, if readings are stable, add 1 to 2 squares of 85% dark chocolate daily and continue monitoring. In week 3, if readings remain stable, add 1 70 milliliter shot of Beat It Sport concentrated beetroot juice in the morning and monitor for the first 3 to 4 days with particular attention to how you feel upon standing. Bring your blood pressure log to your next physician appointment. If readings have dropped meaningfully and consistently, that is a conversation about medication adjustment, not a reason to silently continue a combination your doctor does not know about. This sequential approach allows each food's effect to be isolated and evaluated before the next is added. It allows your physician to see what is happening in your readings and to make informed adjustments to your medication. And it ensures that if your blood pressure drops too significantly, the most recently added food is the obvious variable to remove or reduce, rather than a complex multivariable situation that is difficult to untangle. These three foods, beetroot juice in the form of standardized concentrated products like Beat It Sport by James White Drinks, dark chocolate at 70 to 85% cacao in doses of 10 to 30 grams daily from products like Lindt 85% or Hue Simple Dark Chocolate, and hibiscus tea brewed from single-ingredient products like Frontier Co-op Organic Hibiscus Flowers or traditional medicinals hibiscus tea bags have genuine, clinically documented blood pressure-lowering effects. In specific circumstances, particularly during medication titration windows, the onset of their effect is faster than a newly adjusted amlodipine dose reaches its full therapeutic plateau. That is what the title of this video means. That is the full, accurate, complete statement of the evidence. What they are not is a replacement for medication. What they are not is something to add to your routine without your physician knowing. What they are not is a permanent solution to a condition that in most people over 60 reflects decades of cardiovascular adaptation that no food, however well evidenced, can fully reverse alone. What they are is a genuinely powerful complement to the medication and lifestyle management your physician has prescribed, used with the same thoughtfulness, monitoring, and communication that every cardiovascular intervention deserves. Somewhere today, a patient over 60 is managing blood pressure that is not fully controlled, taking medication that is working but not quite enough, and has never been told that three foods with strong clinical evidence could contribute meaningfully to closing that gap, not by replacing the medication, not by ignoring the physician, but by understanding the biology, selecting the right products, introducing them correctly, monitoring the results, and having the conversation with the doctor who deserves to know what their patient is doing. That conversation starts with understanding. And after today, you have the understanding to start it.